Hello, and thank you for joining the Living with ALS webinar series. I am Lori McFerrin with the ALS Association. The topic of genetics and ALS has created a lot of interest of late. So we hope today's information is useful and answers questions you might have about genetic counseling and testing. Before we get started, I'll remind you of just a few housekeeping items. Today's webinar will be recorded and will be added to our website probably within a day or two, along with our presenters' slide decks. The Q&A and chat features will remain open from now throughout the presentation. We will hold all questions, though, until the last 15 minutes or so. During that time, we will also invite verbal questions. And so if you prefer to ask your question directly to the presenters, please just use the raise hand feature and we will get to you as soon as we can. And lastly, remember to stick around, please, and answer that very brief 3-question survey at the end. Those survey results are shared with our presenters. And as you know, we take that information to prepare future presentations. So now let's get to our presenters. Krista, I think we're starting with you first.
Yeah.
Welcome.
Well, thank you so much. And thank you to everyone for joining us today. My name is Krista. I've been a genetic counselor for about 10 years. I graduated from the University of Cincinnati genetic counseling program back in 2014. And since then, I've worked in a couple of different settings, both in clinical and in research, as well as a little bit of industry time. I've worked with a lot of individuals and families with ALS and other neurodegenerative conditions throughout my career. These are my conflicts of interest, which is mainly my current affiliations as an independent contractor for genetic counseling. And among these are the settings where I currently provide genetic counseling for ALS. So this includes through Gray Genetics and our partnership with Sanogenetics for the Light the Way program, which is what we're talking about today. And I also see individuals with ALS through my work with Synapticure, which is a telehealth neurology clinic. And so from that background, I'm really excited for the opportunity to speak with you all today. I am going to be starting us off by talking about what we know about the genetics of ALS and what we could potentially learn from genetic testing. Now, some of you may be very familiar with this topic and have had genetic counseling or genetic testing yourselves, but for others, I know this might be the first time that you're really hearing about it. So, to jump right in, we know that sometimes ALS can have a genetic cause, but not all the time. So this is a little bit, unique as far as it's not kind of like other genetic syndromes out there where we know it's always genetic. For ALS, we see this split. And so how often is ALS genetic, or how do we figure that out? And traditionally, we try to answer that question by looking at a person's family history, which makes sense because we know in general, we see that if there's a health condition present in your family members, you might have a higher chance of experiencing that health problem yourself. And so when we look at individuals with ALS, most people are the only one in their family with the condition. And this is the case around 90% of the time. And we've traditionally labeled this as sporadic ALS, suggesting that a person's ALS occurred by chance without a specific cause that we can identify. Now, around 10% of individuals with ALS also have family members with the condition. And so we labeled this familial ALS, and we're most suspicious that these individuals and their families have an underlying cause for their ALS. So what does it mean for ALS to be genetic. Having a genetic form of ALS means that we can identify a change in a person's DNA that is causing their ALS. I like to think of genetic testing as doing a spell check on our DNA. And here you can see that where we expect to find the DNA letter G, it has been changed to the DNA letter A. And so this is what we call a genetic mutation. Now, genetic mutations in over 30 different genes have been linked to ALS. So you can see some of the names of these genes listed here. And a gene is a specific section of DNA that gives the body the instructions to make a specific protein. And so you'll see, the SOD1 gene code gives the body the instructions for the SOD1 protein. Now, these are genes that we all have. We all actually have 2 copies of each of these genes, one that we inherit from our mom and one that we inherit from our dad. And so genetic testing isn't looking to see if you have the gene, but it's looking to see if a person has a mutation inside one of these genes that's causing that gene and therefore its protein not to work properly. Okay, so that's kind of what we're looking for, what we're talking about when we say genetic testing. Now, how often do we find genetic mutations? And as you might imagine, we do find genetic mutations much more often in individuals with familial ALS. And so in that group of familial ALS, we find a genetic mutation around 70% of the time. So in about 70% of individuals we test. However, in individuals with the sporadic ALS, we still find a genetic mutation around 10 to 15% of the time. And so while someone's family history can tell us who is most likely to have a genetic mutation, we really don't know until we look. And because of this, we've also been trying to get away from using these terms of familial and sporadic ALS and maybe move on to terms like genetic ALS and non-genetic ALS, because this could give us a more accurate picture of what category a person or a family falls into, and will also hopefully help to move us away from the traditional thinking that only individuals with a family history or familial ALS need genetic testing. Because we know that if we don't offer genetic testing to everyone with ALS, we're always going to be missing this group of people with seemingly sporadic ALS who still have a genetic mutation. Okay, so that's kind of why we want to do genetic testing to find these genetic mutations. But some of you might be wondering, well, what actually changes if we find a genetic mutation? And the answer is, well, it depends, but it can be quite a bit. And so when we find a genetic mutation, we consider this a positive genetic test result. Now, finding out that someone has one of these genetic forms of ALS can impact both that individual as well as their family members. So for the individual, first and foremost, we've identified the reason why a person developed ALS and a concrete explanation for their disease. Now, on top of that, sometimes having a certain genetic mutation can change the medical management recommendations we have about how to treat a person's ALS. The biggest example of this is for individuals with a mutation in the SOD1 gene. That mutation makes them eligible for our first gene-targeted therapy for ALS, which is called Qalsody, and this was FDA approved last spring. And so the goal of Qalsody, or the theory behind it, is that it can really target someone's genetic mutation And if we can target the genetic reason for someone's ALS, we can treat their specific type of ALS better. Now, SOD1 mutations are rare, but we also have clinical trials for other gene-targeted therapies, including for individuals with mutations in the FUS gene and the C9orf72 gene. And so hopefully these types of medications will continue to be developed and continue to be effective for other ALS genes. And then we can really move into more targeted therapies for these different genetic forms of ALS. Okay. A positive genetic test result can also warn us about other future health risks for someone with ALS. Now, mutations in some genes cause an increased risk for ALS and other health conditions, like other neurodegenerative diseases. Now, the most common condition that we see genetically linked with ALS is a specific type of dementia called frontotemporal dementia. Other genes are also associated with risk for Parkinson's disease or other health conditions. Now, identifying a positive genetic test result can also provide information about other family members' risk to develop ALS in the future. So first, it can tell us, well, what are the chances that other family members have the same genetic mutation? And this is what we call the inheritance pattern of a particular gene. For example, many genes associated with ALS follow a dominant inheritance pattern, meaning that, go back to everyone has 2 copies of these genes. And if a parent has a mutation on 1 copy of their gene, and their second copy of the gene has no mutation, each of their children will have a 50-50 or 1 in 2 chance of inheriting that copy of the gene that has that mutation. Now, that's kind of that first layer. The second layer is the fact that different genes have different penetrance levels. And penetrance refers to the question of, well, if a family member has a genetic mutation, what is the chance that they will actually develop ALS or another health condition in the future? And this number is different for different genes. So some genes have a very high penetrance, meaning that there's a pretty high risk for someone to develop ALS if they have that mutation, while other genes are associated with a lower penetrance, meaning that there's maybe a medium-sized risk or even a small increased risk for ALS. So as you can see, there's a lot of potential information we could learn from a positive test result, but it's a little bit different. It's all dependent on, well, what's the specific gene that someone has, or what specific gene someone has a mutation in. And so if possible, I always recommend that everyone with ALS have genetic counseling as part of that genetic testing ordering process, because I don't want someone to be caught off guard if we find a positive genetic test result. For the same reason, if a family member is thinking about getting genetic testing or just wants to understand what the mutation in their family means for their own risk, I always encourage them to talk to a genetic counselor because they can get some really much more personalized information. Now, not everyone who has genetic testing gets that positive genetic test result. As we saw before, many people get a negative genetic test result. And having that negative result means that no mutations were identified in any of the genes associated with ALS risk. This type of result can also provide a lot of information for individuals and their family. So it's important to remember that a negative test result doesn't mean that someone doesn't have ALS. right? Instead, it means that their ALS is unlikely to be caused by a genetic mutation. So, a negative genetic test result also means that the risk for family members to develop ALS is likely low. Now, we can never tell someone that their family member's risk to develop ALS is 0% because we all have some risk to develop ALS, but we can estimate it to be similar to the average risk for ALS, which is less than 1%, so still pretty low. I do always remind people that there are limitations to genetic testing, though. And so, if someone has familial ALS or a family history of ALS and has negative test results, we still might be suspicious that there's a genetic testing that our current testing technology can't find or in a gene that we haven't discovered yet. And so, we always want to interpret those genetic test results in the context of someone's family history. And that's again why we recommend genetic counseling for all individuals going through genetic testing. So we can also help interpret your genetic test results and put those into context for you. Now, there is a third type of result that we can find on genetic testing, which is called a variant of uncertain significance. And this means that a DNA letter change was identified in one of the genes, but the lab doesn't have enough information about that change to know if it causes risk for ALS or not. Now, these results are common mainly because we're still learning about all the different genetic changes we can find from person to person. And so we know that many of these changes are actually benign, meaning they don't cause any health problems. And I like to think of benign changes as the difference that we can see between American English and British English. We can spell words the different ways, but they ultimately mean the same thing. We have a lot of that type of variation in our DNA as well. Ultimately, as labs learn more about these variants of uncertain significance, they will reclassify or update their genetic test results over time to be either that positive result or that negative result. And so, in general, because we know most are going to get reclassified to benign, we generally don't change our recommendations for medical management or family member testing based on this type of result. So up until this point, we've been focusing mainly on how we interpret genetic test result for a person who has ALS, but there's some key difference in how we approach genetic testing for family members who don't have ALS. And importantly, genetic testing results for family members help to determine whether or not they have an increased risk to develop ALS in the future. So genetic test results don't diagnose someone with ALS right now. And like we discussed earlier, risk information can really be broken down into two key questions. What is the chance that they have the mutation in their family? And then, if they have the mutation, what is the chance they'll actually develop that ALS in the future? Now, I pose those questions assuming that another family member has already had genetic testing for ALS and identified a genetic mutation, but we know that that's not always the case, and we don't always have that information for every family. So we can still order genetic testing for family members if we don't know what mutation is running in their family, or if there is a genetic mutation running in their family. And in this scenario, there's just a few more limitations in our ability to interpret their results, but we'll always interpret their results the best we can with the information we have. So before a healthy family member undergoes genetic testing, it's important to consider if or why they want genetic testing. Some family members know without a doubt that they want genetic testing results, and other family members know that they definitely don't want genetic testing. And I would say most people fall somewhere in the middle. So I always recommend that family members talk to a genetic counselor to talk about the pros and cons of genetic testing and really understand what they could learn from their results before making that final decision. And I know there's no right or wrong answer about whether or not to have genetic testing. So as a genetic counselor, I'm really focusing on helping someone figure out what's the best decision for them. We can also make sure to make people aware about what the potential impact genetic test results can have on a person's ability to get a new life insurance policy in the future, how it can impact their family planning or other life decisions. And there's also research opportunities that some family members might be interested in. Again, the biggest one being for the SOD1 mutations, where there's a clinical trial called the ATLAS study for to see if Qalsody treatment can prevent or slow someone's ALS if they start treatment before they even have any symptoms of ALS. All right, so I know we've covered a lot of ground in a really short amount of time, and I look forward to answering any questions you have during our Q&A at the end. I hope I've been able to illustrate why it's important for genetic testing to be offered to all individuals with ALS, because genetic test results provide valuable information about whether or not someone has a genetic form of ALS, which can impact their medical care and provide information for family members. In addition, we know that not everyone with a family history of ALS will have a genetic mutation, and not everyone with a mutation in one of these genes will develop ALS in the future. So it's important for everyone who is seeking genetic testing to also speak with a genetic counselor. Now, talking to a genetic counselor doesn't mean you need to have genetic testing. So family members are also recommended to have genetic counseling just to understand their own risk. I expect family members to ultimately make different decisions about if to have genetic testing or what to do after learning about their results. That's what I expect, and that's okay. So again, my goal is really to help you understand what results mean, what your family history means, and figure out what's the best decision for you. And if you do to have genetic testing, to put those results in the context for you. And with that, I am going to turn it over to Paul to tell us more about the Light the Way program.
Thanks, Krista. That was a great overview, a great introduction. And as you may tell, I'm one of those variants of uncertain significance with a slightly different accent. So apologies if I'm totally incomprehensible and you will not deem me pathogenic. But let me just see if I can get my slides going.
Yeah, my British English, American English analogy always feels a little bit more on point when I'm with you, Paul.
Brilliant. Yes, I think we generally all are aiming in the same direction, at least. Even if I spell neurone with an e at the end, but neuron without one. So, great. Thank you. Well, thank you so much to ALSA for the invitation to participate today. We're really grateful to be able to share our experiences and the program that we've been working on at Sanogenetics. So, like Krista, I'm going to share my conflicts of interest. So, I am an employee of Sanogenetics. So, as a consequence of that, I have stock and stock options in the company. Prior to that, I was a consultant for a number of years to a variety of companies. I've just put the ALS relevant ones here, but I've done some consulting and some advice for Biogen, Ionis, LifeArc, Patients Like Me, and Unite Genomics. And in terms of personal disclosures, as we're about to see, I'm a family member of somebody living with ALS as well. So I have kind of an unusual story in that I've actually been in the field for quite a long time. This is me when I had a bit more hair, about 20 odd years ago, when I was working as a PhD student at King's College London. And what I was studying was the overlap between ALS and frontotemporal dementia, which, as Krista's alluded to, we do see from time to time. But back then, we didn't know about things like the C9 mutation that we now know can appear in some families as ALS and some families as FTD, or in some individuals even both. And so what I was trying to do was do cognitive tests, behavioral tests, as well on people with ALS, some of whom had a SOD1 mutation and some of whom didn't. And we were also asking them to undergo PET scanning and MRI scans to see if there were changes in the brain that we could identify. So I'm a neuropsychologist by training, so I study what parts of the brain are affected and what functions they have in neurological disease. So I was doing that work for a number of years. I then transitioned over to working for a tech company in the US called Patients Like Me, which was founded by a family affected by ALS. And we did a number of research studies with groups you'll be familiar with, like Dr. Rick Bedlack's ALS Untangled, and a number of others. But my position in the space kind of changed a lot about 10 years ago when a family member, my father-in-law, was diagnosed with a slowly progressive form of ALS in 2014. And here he is a few years in to his relatively slow progression where he was having difficulty walking and using a rollator. My eldest daughter is here. She was just learning how to walk. So the sort of neurogenesis and neurodegeneration kind of meeting in the middle somewhere. And then over the course of years, they diverged. So my father-in-law is now in a power chair all the time, whereas Annabelle and her sister are running around the place all the time, trying to be helpful, I think, not trying to get rode by the wheelchair too much and occasionally pressing the buttons to make them go beep. But this has given me quite a specific perspective of someone who's been a researcher, been an advocate, been a caregiver. And during this experience of the diagnosis and finding about opportunities for research, my father-in-law was offered genetic testing, and we went through this experience of being very nervous for a decent amount of time about what that would mean, what would be the implications for him, his family, his descendants, etc. So what I want to say, though, is that to some extent, the reason he was offered that testing was because of the promise, the potential promise of genetically targeted therapies. And many of you may have seen this data presented, or if not, I'd recommend you do look it up, where data on an individual called Anna, who's been very public about the story and shared her video on YouTube and other places, has actually had a quite pronounced response to a gene-targeted therapy. So on the one hand, if we had found out that my father-in-law had a genetic form of ALS, that would have had serious implications for the rest of the family. But it could potentially have meant, that someone might be eligible for the types of studies like Chris has just mentioned, or for much more targeted therapies than some of the other drug trials we've seen in the past that took a sort of broader approach and didn't always have as much success. So, through my time at King's and at Patients Like Me, I have seen this ALS FRSR curve go down and to the right over 10,000 times. This was the first time I'd ever seen a sustained recovery identified alongside a change in the neurofilament biomarker. And so this really, took my breath away as it did many other people in the room, and a credit to Dr. Schneider and the whole team that worked on these technologies. But I think what it's really given me hope for is that there is a thread we can pull on in ALS, a much more targeted, much more specific thread for how to unravel the condition, and that is these gene targets. But what we found as I went from understanding my own experience, our family experience, to the broader community's experience, and many of you on listening on this call or watching on YouTube will be in this position yourselves, we actually found that as we started engaging with the community, listening to people with lived experience, that other people who are at risk of genetic ALS, whether because they already have a diagnosis of ALS or because they're a family member of somebody who has or had ALS in the past, really feel quite alone and in the dark. So, for example, many of the ALS specialist services that exist for people who are diagnosed with the condition may not be accessible to family members. There may also be considerations around insurance and other fears, discrimination, stigma that keep people from accessing those services through the typical ALS clinic. So, we identified consistently, both in the US, the UK, and having some conversations with folks in other countries, a consistent set of fears, of barriers to care, of burdens that people were carrying, and of needs that they had. One of the burdens I particularly want to point out was around testing costs. So an advocate who I knew who was very involved in clinical trials a few years ago when we started talking about this had been quoted somewhere in the order of $7,000 or $8,000 for a test because their insurer wouldn't cover it. Now there are sponsored testing programs. We'll talk about Light the Way in a moment. But that seemed like a really important thing. And also, sometimes when we are looking at researchers talking about different family members who might carry a gene and are trying to do different types of studies on them, I think it's always really important to highlight these people have been caregivers. They may be caregivers now, they might be multiple caregivers, and so there's a variety of impacts and stresses on those people that I think are pretty unique. But the needs that came out very consistently were education, whether that's factual information or much more personalized education like you might get with a session with a genetic counselor like Krista to understand the particular dynamics of your situation. We've seen a lot of benefit from peer support, and I want to sort of highlight here our partnership with End the Legacy, who are a fantastic sort of user-led organization that really champion advocacy, engagement, and research, as well as peer support, because it's only someone who's really walked a mile in your shoes who can really understand that perspective and really offer that profound empathy as well as information and guidance. And we also were seeing lots of questions around family planning that, again, could be very personal to people, but we want to ensure that there was this foundational base of education that people had before they started really engaging with understanding things about starting a family. Things like IVF have been alluded to as potential options. So the approach we took, so Sanogenetics is a UK-based startup company, and we actually managed to get a grant from the UK government, an organisation called UKRI, and we were able to develop an online platform intended to be active in multiple languages, multiple nations, which at no cost to people at risk of genetic ALS, whether they're patients or at-risk family members, could provide this foundational layer of genetic education that we've talked about. So sort of a series of blogs and then quizzes to check that you've understood them. And then once you're engaged later on in the virtual waiting room, an ongoing series of educational articles that can be general about ALS and genetics, but also targeted towards specific genes for people from families with things like SOD1 or C9. Once people have done the genetic education, if they want to, they can then access free pre-test genetic counselling, so that you can just book an appointment online and have kind of a Zoom call or a telephone call right in the convenience of their own home, so a little bit more private perhaps than going to a hospital and needing to talk to a physician first and all that kind of thing. We offer at-home genetic testing, so there's about 40 genes on our panel, so quite a broad, comprehensive assessment of ALS and some of the genes associated with FTD as well. And that's based with just saliva that you could do at home again and just pop it in the mail and have that returned back to the lab for analysis. The actual results are returned to you by the same genetic counsellor in most cases that has seen you for the pre-test counselling, and it will actually be them who is helping with the interpretation of these results. Additionally, if you've already had genetic testing in the past, you can actually upload your previous genetic test result to the platform. Our scientists will review the report just to check that all the relevant things have been done, and then you can book in a post-test genetic counselling session with a genetic counsellor to help personalize and understand what this means for you. So you might have had a brief conversation in the clinic that took 2 or 3 minutes and used lots of complicated jargon. What you actually might want is a more dedicated session where you can say, well, what does this really mean? And how should I interpret that? So that's another option that we offer. Once people know their results, we'll try and plug them into the legacy, and they can access advocacy and peer support. We have informational content that would come through on email about family planning options. And then really one of the objectives of this is to connect people to research studies and clinical trials for which they might be eligible. So studies like that for SOD1 that Krista mentioned would be potentially accessible to those people who meet eligibility criteria once they've had their test result returned. And then as therapies come online that are targeted to particular genes, we hope that we'll be able to accelerate the speed at which people get access to those approved therapies under the guidance of their clinician. So initially, we've launched in the US, and actually we have resources in both English and US Spanish. The URL is likethewaystudy.com, and I think I will be able to pop that in the chat just in case you want to have a link to it. But now I'm going to show you what it looks like inside the platform itself. So hopefully this video stays running full screen. There we go. So the initial landing page gives you some information about what the program involves and helps you to understand what's going to happen next. There's an informed consent process so that you can understand how your data will be used and what happens if you change your mind, that sort of thing, so you can go through that. We ask some basic demographic and clinical questions. So if you were diagnosed, how long ago? And like I mentioned, if you've already been tested, then you go down a slightly different path where you can upload your previous report. Whereas if you've not previously been tested, then that's the path by which we would offer you the pre-test counselling and could offer you the at-home testing. So if you've been tested in the past, you can upload that as a PDF or a photograph of a report, or an image, or in whatever format you have it, and then we will review that. If you need sending a test kit, then you can specify where that needs to go. And your genetic counsellor who you've spoken to will be able to see the process of that kit as it goes through all the different steps. So as it's been shipped, as it's delivered, as you've had it at home, and then as you sent it back. And then once you've gone through that, you can access our virtual waiting room. You can see some of the resources that we have, click through and go back over some of the educational content. And then, yes, as I said, there'll be sort of monthly communications via email to keep you informed about different educational opportunities and things like that. And it's also through this portal that you would book in your genetic counselling for the post-test return of results. So it's a personalised experience. People are going to get different information depending on where they are in the process and their situation. But the education's presented very simply. It's been co-developed with people with lived experience and generated and tested by genetic counsellors with a great deal of experience in ALS. So the actual return of results will come through from the genetic counsellor, like I say, but then after you've had that session, you get those results as a download, so you are in control of those. They do not automatically go into your medical records, so you maintain control over who sees that, for example. That's a little bit different than some other programs, some other pathways. And like I say, we're currently available in Spanish. We're interested in, what other regions might we be able to go to? What sort of translation processes would we use? Always consistently trying to make sure that, we're reaching a very high standard of clinical forward and back translation to make sure that everything makes sense. So in terms of our objectives, we really primarily want to improve access to treatments as they come online and to trials. I think helping at-risk families is really important to us because, like Krista mentioned, studies that try and intervene earlier are much more likely to have an impact on the condition. So delays in diagnosis mean by the time many people are in trials, the condition has been progressing for quite a while, and earlier it always seems to be better. In the long term, I hope to be able to develop this beyond the US, beyond English-speaking countries, and start to address some of the equity gaps that exist. So there are definitely gaps in care and inconsistencies in care in developed countries like the US, but there are many countries that just lack counselling and testing altogether. And so this more digital platform is a way of us trying to see if we can really reach more people where they are via technology. Excuse me. Along the way, we're also trying to show that if we provide pre-test counselling, post-test counselling, we provide a lot of the education in between the clinic visits, that we can actually, help to test more people, offer more opportunities without some of the, clunkier ways of doing things that we've had in the past, like, having to wait for paper results to come back, or, traveling into a hospital to have what could be a brief conversation, all this type of stuff. And ultimately, what we'd love to do, with partners, I don't think this is something we'd run ourselves, is to lay the foundation for really a global scale preventative clinical trial by really helping to build a cohort of people who really want to take part in research, who are gene carriers, who are asymptomatic, so that we could look at everything from, drugs or other therapies, gene therapies, maybe even some forms of non-pharmacological intervention that could be helpful. So how are we doing so far? So we originally announced that this was launched in the US earlier this year, earlier in 2024. So far, the analysis we did for a recent conference, an FTD conference actually, did an analysis of how we've been doing in terms of our education. So having delivered education to about 100 people and genetic testing to 20, although those numbers have gone up subsequently, we actually were really pleased to see 100% satisfaction rate with the quality of the information that people needed to make an informed decision about their testing. 97% agreed that they felt in control about whether or not to have genetic testing. And as Krista said, just because you've done the education doesn't mean you have to have the counselling. Just because you've had the counselling doesn't mean you have to have the testing, right? So you are in control of your decision about when to take the next steps. And then finally, 94% of people agreed that this complex topic, the fire hose, as we said, was explained in a way that you can understand. So, like I said earlier, I think our ambition here is to look at this on a global perspective. So ALS affects people all over the world. This is a density map of where all the people in the world live, where they're most highly concentrated. And you can see these arrows are the places where you can probably get quite reliable testing, quite reliable care, but they're not evenly distributed. So work from the International Alliance of ALS and MND organizations has identified major gaps in Latin America, in Asia and Africa. And, I think the opportunity to develop a standard set of education that might sort of support all these users that are everywhere else that don't have an arrow yet is really worthwhile endeavor that we need to advance. So one of the ways we're doing that is we're looking at seeing, can we build kind of a faster version of like the way to deploy in different countries. So looking at whether or not we could just take the enrollment aspects, the education aspects, and the upload reports and build that out as kind of a lighter weight pathfinder, if you will. So trying to find out where people might engage in the program, what sort of feedbacks and suggestions they have, rather than having to also incorporate the counselling, the testing in every other country, because as we found, there are regulatory issues, there are licensing issues that can make that quite complicated, and would really like to see if we can move a bit faster to really try and close some of these gaps that exist. So finally, just in closing, I'd certainly, if you're interested in going down this route, by all means, check out Light the Way. The link is in the description there. And you might also be interested in some of the resources that End Legacy has put out, really around different topics like research, education, community support, and advocacy, if you really wanted a deeper dive on not just on the state of the art now, but actually what the community is doing to try and change the status quo and push things forward, which I think has just been really, really inspiring. Just some frequently asked questions, because one of our core values is transparency. The business model here, we are a for-profit company. We do work with biotech and pharma companies across a number of therapeutic areas. Although, like the way it was initially funded by the UK government, we are actually transitioning it now to being a sponsor-funded program. The participants will always own the data. That's really important. Sano holds a non-exclusive license, and we only ever use de-identified and anonymized data for our work. Really important just to emphasize again, this test result does not appear on your medical record automatically. You could send it to your care team if you choose to. You could upload it to your portal if you choose to, but actually you control that information. And then finally, just in terms of how Light the Way differs from other sponsored testing programs, we're using saliva instead of blood. It can be ordered through the system and through your conversation with a genetic counsellor. It doesn't need a separate physician conversation to go through the doctor's office. We've got a broad gene panel. We're hoping for a number of other benefits that we can offer through this digital system. So I hope that that's been useful and sort of shown how trying to get one person's experience through into a solution that can work for everybody might be a new approach to do things. But really excited to take your questions and start the discussion. Thank you.
Thank you, Krista and Paul. Really good information. And as a reminder to folks, we want to hear your questions if you have them, but I certainly prepared some just to get the conversation going. So folks who have joined, put your questions in the chat, raise your hand if you want to ask verbally, or use the Q&A. Krista, I loved how you said we're trying to get away from familial versus what?
Yes, sporadic.
Familial versus, thank you, sporadic. And so we're talking about genetic versus non-genetic. And so that is a real push to make sure everyone gets tested, I would imagine, or everyone gets educated, counseled, and determines if testing is right for them. I have a feeling that we might hear from folks that I haven't been offered to have testing. typically people are being asked, is there anyone in your family who might have other neurological conditions? And so one of our jobs, I think, within the ALS community is to help people advocate for what they think they need. And so I wonder if you can offer us some guidance on, or offer our community some guidance on how to advocate for testing if your care team is of the mindset that that it's not necessary.
Yeah, and I hear you and I've heard that from participants who said, especially, and I think the biggest one of the biggest kind of barriers we have is for families who have this long history of ALS and no one has had genetic testing because it wasn't available at the time, or something like this, and now a family member is like, well, I want to find out about my risk, and physicians are still telling them, well, I can't offer you genetic testing because someone with ALS hasn't been tested. And you kind of run into this catch-22 of like, well, my family member has passed away. I like genetic testing is not possible. And I think that I always encourage people to keep asking for what they need or keep looking for different avenues. I know Light the Way has opened up that access to genetic testing because a lot of my families there, my individuals that have come there have said, I tried to do genetic testing like the right way. I always say there's like the ideal scenario and then there's reality where we live. And so keep asking, or if you ask your physician and they're not able to order that testing for you or refer you to a genetic counselor, take advantage of one of these sponsored programs, take advantage of Light the Way. Or we have a genetic counseling directory. Just go straight to the genetic counselor and see if you can find someone in your area or on telehealth.
That's great. And that's the link that you shared earlier,
Yes,
right?
and I will drop that in the chat right now. That's our National Genetic Counseling Directory. So we have options to look for people locally, just search based on your zip code, as well as kind of telehealth.
Excellent. Thanks. I want to quickly, Paul, it looks like you've got a thought. Did you want to share a thought before I go to Sharice?
I was just going to say it's important to say this is an ongoing topic of debate in the community, and I wanted to share. There's a link to an article called "The Importance of Offering Early Genetic Testing in Everyone with ALS," written by a number of leaders in the space, and it makes the key points. So if you are encountering resistance, just know that some of the top experts in our field are making this case to their colleagues, right? And it's unfortunate when it's put on families to have to be your own advocate to get care and to suddenly be dabbling in genetics. Like, isn't this the professional's job? But just to know that, like, because this is a newer thing, because it's overturning some established practice, it takes a bit of time to work through the system. And if you're equipped and prepared to have that conversation a little better, you can hopefully maybe get to the outcome that you need.
Thank you. And if anybody hasn't captured that article that's in the chat, feel free to reach out to me in the survey after today's call, and I can send that to you, or we can put you in touch with Paul for more info. I want to go to Sharice. Tamara, I wonder if you can help us. Sharice would like to ask her question, I think. Sharice,
Oh,
are
I'm
you
sorry.
there?
Yeah, I don't have a question. I'm sorry.
Oh, that's all right. No problem. Paul, when you were talking about different disclosures and you said we are for profit, sometimes people will misunderstand that and think that it's going to cost something for me to participate then. Can you clarify whether there's a cost to your
Sure.
participants?
Yeah, so for Light the Way, there's no cost for our participants at all. So the way this was originally funded is we got a grant from the UK government to pay for setting this all up, and to pay for a tranche of the tests so that we could help find people and refer them into trials, and try and get them the education they need. the business model that operates with a number of these programs is that a pharmaceutical company or a biotech company that is looking for participants will often sponsor tested programs like this. And what it means is that that's able to sort of offset that cost for the end users. And that was really important to us because, you know, that story that I told you about the advocate who was asked to pay a lot out of pocket, that was to find out if they were eligible to be in a trial. And it just seems crazy to me that, you know, ultimately if these trials succeed, they will turn into products that will be paid for by insurance companies and all the rest of it. And you're kind of going, well, it doesn't make sense that a participant or a potential participant would end up paying out of pocket for that. And, you know, I think these sponsored testing programs have changed that landscape for the better. But it was really clear to us we didn't want a financial barrier to be something that stopped people from accessing the information and the testing that they needed.
Thanks for the clarification. We have a question that asks, how can we help a asymptomatic gene carrier prepare for conversations with their care providers? Is there education out there for primary care physicians?
I think that there is, I think we do have resources, we do have information. One of the things that I often recommend is sharing like my genetic counseling notes with primary care physicians. That's a resource that is a personalized resource that's always out there and something that I recommend because, you know, again, we see a lot of people who are saying, I'm explaining what my results mean to my physicians and I'm, you know, needing to advocate for myself or to let them know kind of what is going on and what this genetic test result actually means.
And that does sometimes happen. Amber, does
Yeah.
that answer your question? And Paul, did you have something more to share?
Yeah, I was just going to say, so, you know, I think being the academic here, I tend to nerd out and go into the literature, but just to say, if you really want the extra firepower, there is an article by a colleague of ours called Jennifer Rogenbach, who with a number of genetic counselors and clinicians, something called the ALS Genetic Testing and Counseling Guidelines Expert Panel. They might need some branding help, but about a slightly snappier name. Have a whole bunch of recommendations for healthcare professionals. And they both synthesize recommendations from places like the American College of Medical Genetics, who are very reputable in the space, but also results of a survey of clinicians. And so, you know, one of the things that can happen with someone like a PCP is back at med school, they might have spent half an hour on ALS, right, a while ago. When, you know, when I trained 20 years ago, we thought 2% of ALS was genetic and there was one gene that we had found so far, right? So things change. So these recommendations, they're by scientific standards, hot off the press, like 2023. Recommendation number one, all persons with ALS should be offered genetic testing. You can't be any clearer than that. And, you know, I think that really helps, right? So it's not just one person advocating for it in a family. You're saying, no, look, practice has changed and you don't have to make this up. Here are the steps that, you know, leaders in the space are recommending you follow. So again, might be a little heavy reading, bedtime reading. But yeah, it's two different articles. Yeah, just in answer to that query there. But they're both open access, so you don't need to be kind of a, you know, a library member or anything to read it.
Paul, will you repeat that then one more time, what that article is, just so that so folks can
You
make
know
a
what?
note?
I think Krista probably knows more about the actual process, but it was basically because everyone was doing things kind of differently, and so they got all their heads together and said, well, how should we make a consistent set of standards? But Krista, do you want to talk a little bit about how that really gels with the professionals?
Yeah, so I think it really is a piece of kind of counseling information. When I read the article, it's a lot of explaining to like a physician practice, like how to provide genetic counseling to patients, I think. And so kind of giving those, like really kind of breaking down a lot of the if-then scenarios. So if your patient has symptoms, this is kind of the set to follow. If your patient does not have symptoms, these are the things that you can consider. If your patient is thinking about genetic testing, here are the topics of conversations you should be having with them.
Yeah, and it's an attempt to get some consistency. So, for example, it's recommending that the genetic counseling should be for genetic counseling education should be provided to all that want it. and that the counselling should precede the offer of testing so that people understand that it's informed decision. And as an example of, I think you were mentioning, Laurie, earlier saying, oh, do you have any neurological disease in your family? Well, I could ask that a bunch of different ways. I could ask that as an open-ended question. I could go back to your mom and your dad, or I could go back to your grandparents. And actually what this recommends is going back 3 generations at minimum. And also there's been some variation, like, do you just say ALS? Because if your great grandma had ALS, there probably wasn't a neurologist at an EMG back then, right? So it's about also ascertaining other related motor diseases, other dementias, other movement disorders, or even psychiatric diseases, things like bipolar disorder, schizophrenia, schizoaffective disorder, that maybe if that's what was diagnosed 70 years ago, we might now recognize slightly differently, right? So these guidelines give a lot more consistency so that physicians and other healthcare providers don't feel like they're having to do the primary research themselves. So, they're really evidence-backed guidelines.
And I will say that for the individuals who have already gone through the genetic testing, have already found that they're a gene carrier, at that point, it is reasonable to request a referral to a neurologist, or a referral to a neurologist, especially one that is familiar with ALS or specializes in ALS, because that's who's going to be able to give you the most information about, well, what kind of things do we want to consider as far as baseline testing for a healthy person? What are signs and symptoms that should make you kind of come back and see the neurologist again, versus what are signs of symptoms that you don't need to worry about, right? Because I know one of the biggest things with if you're a healthy person and you know that you're a gene carrier, all of a sudden kind of you are going to be hyper aware of, well, every time you have a muscle cramp or something like that, right? And so kind of asking for that referral to the neurologist, because that's what would happen if, someone has ALS, your primary care physician is not going to be the one treating it. So they're also kind of not prepared to treat or give that anticipatory guidance to a gene carrier as well. So I think that's the other piece that I would say. Once you have that genetic test result, go on to that next step, and you can see a neurologist at that point.
Absolutely. And back to your comments about the article that supports conversations with physicians or physicians and patients. When we know that it's difficult sometimes to get that genetic counselor referral, if doctors feel like they can at least help their patients start to understand, I think that that's really helpful. I want to get to John's question. He states, I did genetic testing that I believe was supported and paid for by the ALS organization. It was my understanding that the genetic testing results are to be shared with many other researchers. Does this sound accurate? It sure makes sense for the results to benefit all researchers.
Yeah. So John, obviously we don't know which research program you're in. There are many research programs that involve collection of blood or other biomarkers. Some people may have had brain scans, some people may have had lumbar punctures or spinal taps. There are a number of large-scale repositories like that, in which once the data has been collected, any bona fide researcher who has a specific plan for it can essentially request permission, and that de-identified data, that anonymized data, can be shared for research purposes. So yes, that generally should be how that goes. It's really important that the consent is given in such a way that allows that. One nuance I'd say is, if you've undergone genetic testing clinically, don't assume that that is also going to researchers. You need to consent separately for your genetic data to be used for research. So there are programs like AMP-ALS, ALS TDI has an ARC program, Everything ALS has got large registries, and I know ALSA and the CDC and lots of other places. The other good news is that they do all communicate with each other in an anonymized way, so that if you're participant in multiple databases, they know not to count you multiple times. So, the researchers in the space are very collaborative. We all want the same thing. And, with the appropriate consents and protections, yes, research data should be available for collaboration.
Yeah. The the collection of data that I was thinking about in his question was the CDC's registry.
Yeah.
And so I wonder, because I think we talk about it a lot, and so people sometimes see that as we're collecting the data when we're really making that referral. So
Yeah, we're all one team.
We are all one team. I know that we are at a time. I think I got to everyone's questions, but I want to take the time to say thank you, Krista and Paul, and to Valerie and Lindsay, who didn't necessarily join us on screen, but they were very helpful in getting us all together today. Thanks for the work that you're doing. Thanks for helping us understand it. And for people who are wanting a little more information, or maybe you had some questions that you didn't ask, if you would like for Krista and Paul to follow up with you, then please just put your email address in the survey at the end of today's webinar, and I'll be happy to put you in touch with folks. Really nice comments. This has been really helpful to folks. So thank you again. I want to just offer a really quick reminder that next month's webinar is kind of all things caregiver. We're going to have an extended hour and a half with a caregiver panel and a neuropsychologist who helps ALS caregivers and people living with ALS to find quality in their living. So hopefully we'll see folks next month. Again, I thank you, Paul and Krista, and I thank everybody who was able to join today. Enjoy the rest of your day.
Thanks so much. Bye now.